primary med bag hang. We already did an IV insertion on this patient, so what I'm going to do is I'm going to go ahead and get my medication ready to go. Medication that I have ordered from the physician is Rocephin. It's an antibiotic. It binds to bacterial cell wall killing bacteria, so it's bactericidal. It helps with lower respiratory infections like pneumonia. Some implications are to assess for the infection throughout therapy, culture sensitivity, and assess for bowel functions. Some adverse reactions to look for are seizures, pseudomembranous colitis. Some side effects are dizziness, nausea, vomiting, and rash. The recommended dose is 1 to 2 grams every 12 to 24 hours. We have available 1 gram per 1 milliliter, and the doctor has ordered 2 grams. I did check the medication and the patient's allergies against the MAR, but I'll make sure when I go in to see the patient that to check to make sure that she doesn't have allergies with this medication. Okay, so the ordered medication is Rocephin, 1 gram q 12 hours over 30 minutes, and it's to infuse in 100 milliliters of normal saline. We have available 500 milliliters per milliliter. So my math, I did my math, and it says 100 milliliters over 30 minutes times the drop factor of 10, which gives me 33 drops per minute, which is about 16 drops per every 30 seconds. I'm going to drop 2 milliliters of the medication in my 3 milliliter syringe. First, I'm going to clean off my medication cap, draw up 2 milliliters of air, push in, draw back 2 milliliters, and this is now ready for insertion. I do have my sodium chloride medication right here, and we're going to put it in here. First, I'm going to clean the hub. This would go into the sharps container. Before that goes in the sharps container, I would not have taken that off. I would re-clean it. And inject the medication in. Okay, I would gently mix the medication, and then I would label it. I would add the drug, the amount, the date, the time, the patient's room number, the start time, the flow rate, and my initials. And I would not cover the sodium chloride, that way you know what it is. Okay, so now that I have all this ready, I'm going to go into, before I go into the patient's room, I am going to prepare my tubing. First, I would make sure that it is clamped off, which is clamped up here, and I would make sure that this is turned off, which it is. I would also label my tubing, date, time, and my initials. Okay, so I would get my medication ready. I would go ahead and clean it off. And I would spike the bag. I would then squeeze, squeeze, squeeze. And then prime my tubing. I would unclamp it and go ahead and open the roller. And I would follow it all the way down until it gets down to here, and then turn it back off and reclamp. This is now ready for the patient to have her medication. Okay, so now I would take all this into the patient's room, first I would do hand wash. Go ahead and put my gloves on. First before I put my gloves on, I would talk to my patient. Hi, Miss Jones, I'm back to go ahead and hang some Rocephin for you. Let me first check your bracelet again. Can you tell me your name and date of birth again, please?
Clara Jones, January 20th, 1942.
All right, everything matches. The doctor has an order here for Rocephin. Have you had this before? Have any allergies to it?
I have no allergies, and yes, I've had it before.
Okay, great. At this point, if the patient had not had it before, I would stay anyway, but if she had not had it before, I would wait 10 to 15 minutes with her just to make sure there was no any kind of signs or symptoms of allergies with her. Okay, I've done my hand hygiene. I'd go ahead and put my gloves on. Okay, and this is where I would go ahead and do my ASASH. Before I would do that, I would tell, as I was speaking with my patient, I would tell her the signs and symptoms, which would be, or side effects, which would be dizziness, nausea, vomiting, and a rash. I would also, before starting this medication, I would check the IV site to make sure there's no edema, redness, or anything like that going on, and it looks good. There's no infiltration and there's no redness or edema. Okay, so now I'd go ahead and start my ASASH procedure. I would grab my saline and wipe off the hub. I would then put in 3 milliliters of saline with a push pause. Push, pause, push, pause, push, pause. Then I would take this off. I would then go ahead and take this off. Re-clean this. If the IV did not have a clamp on it already, I would have cleaned that as well. Now I would go over here, I would unclamp it, and I would go ahead and open up my tubing and watch it for the about 16 drops every 30 seconds. Okay, looks good. I would then just hang this, clean up my area, throw it away. I would tell her I'd be back in a few minutes, and check on her periodically. So I'm going to leave. I'm going to come back. I would do hand hygiene, put my gloves back on, and the medication looks like it's done. So then I would go ahead and turn off the tubing, clamp it back together. I would then look at my side again to make sure there's no inflammation, edema, or anything leaking, and it looks good. Okay, so I'm going to go ahead and disconnect this. Okay. And then I would do my saline again to flush out everything, clean it again, and clean this. I would also put, this would be 3 milliliters as well, push pause. Okay. And now I would If for some reason there was a physician order for heparin, this is the H of the ASASH, and this is when I would also go in after the saline to put it in to keep any kind of coagulation going on at the injection site. And then I would go and document the medication administration, the time, dose, and route, state the patient's condition, documenting intake and output that was put in, and everything, and then what the patient tolerated. And that's it. Thank you.